Well, let me say that I'm very grateful to our doctors' ministry, to each of these doctors who have made themselves available this evening in the midst of a very hectic life that they are living through this pandemic. I want to thank them for willing to conduct this town hall. It's important to our community, especially since our community are people of color. African Americans, as we all know, are tremendously impacted disproportionately by the use of, the activities of the pandemic and the responses of the culture to the plight of Black people as it relates to healthcare bias. And so these issues of healthcare bias are grabbing us even more in this pandemic. And we're grateful to have a cluster of physicians who are our members and friends to come together in this town hall and seek to answer your questions. We hope that you'll be able to put your questions through on the chat and they'll be able to respond to your questions. Let me introduce them. Dr. Naeema Burgess-Johnson, a clinical psychologist. Dr. Cheryl Cottrol, who is neurologist and psychiatrist. Dr. Erica King-Toler, is a psychologist. Dr. Ann Maitland is an allergist and immunologist. Dr. Suzette Oyeku Jones, a pediatrician. Dr. Thomas Price, a cardiologist. And Dr. Barbara Saunders, family medicine. A good variety of medical leadership that is designed to try to get the different aspects of our community's challenges heard. So they're going to share with us the message for our community as it relates to this epidemic. This coronavirus is plaguing us. This pandemic is got us scared, got us depressed. Some of us are sick. We're losing members. We lost one yesterday, lost one today. So it's very real in our lives. Many of our people are either going into the virus or coming out. And some of the persons who are here tonight are people who have already been in the virus and endured it and have come out. So it is probably the most serious thing we shall see in 100 years. And it's the most serious thing that has captured the whole global village. And so Dr. Suzette, I want to thank you for initiating this, and Dr. Sanders, who maintains our doctor's ministry. We really want to thank you. And let's get on with the good information that will help us get through this. God bless you, and thank you for sharing tonight, all of you.
Thank you so much, Pastor. So the roadmap, we've already had our introduction. I'm going to share a little bit about the data so we're all starting from the same page, a little bit about the social determinants of health and how that might be contributing to some of the health disparities, and then start addressing your questions, which we anticipate will probably focus on signs and symptoms, addressing kind of the sadness, the anxiety, some of the mental health concerns, testing, treatment, and research, and then wrap up. So these are our esteemed panelists. As you've heard, thank you everybody for taking the time tonight. So the signs and symptoms, we've heard this and we've shared this before, but just so everybody's starting on the same page. General signs, most people have fever. They can have headache, cough, shortness of breath, chest pain or chest pressure, runny nose, fatigue, or just really feeling exhausted, sore throat, loss of appetite, nausea and vomiting, diarrhea, muscle pain, loss of smell, or loss of taste. And some people, if you've probably heard some people have multiple of these symptoms, some people only have a few, and then we know increasingly that there's some individuals who don't have any symptoms at all that are testing positive as well. So just in terms of consideration. Risk factors for the infection include having a chronic illness, so having heart disease, hypertension, diabetes, asthma, chronic respiratory or lung disease, hypertension, having a prior stroke, chronic kidney disease, and having a diminished immune system. So if you're undergoing treatment for cancer, that might put you at a higher risk. How do we protect ourselves? You've been hearing social distancing in New York State is on a pause. Preventative measures such as, a healthy diet, what we've been talking about for years, kind of fruits, vegetables, vitamin C, zinc, exercise, rest, and adequate sleep. Hand hygiene, so really washing the hands with soap and water, or use of a hand sanitizer if you don't have access to soap and water if you're in public. And then wearing a mask or a face covering in public. New York State has required this, and this on the right-hand side of the slide, you'll see here in terms of how you can securely put on a face mask or face covering, and really want to cover the nose and the mouth area as well. And how to be careful in terms of taking off the face mask as well, so that you don't touch your face when you're taking it off, because that can lead to contamination. This is just some data just to get, Pastor alluded to that this is disproportionately affecting community of color. And this is a New York City map, and you can see the deep purple are the zip codes that have the highest number of cases of COVID-19. And what I circled here is the Bronx, because that's where some of our members come from, but also we have, in terms of Brooklyn and Southeast Queens, definitely are other high areas that are impacted by this infection.
Yeah, hold on.
When you look at Westchester County, this is the current data as of Friday in terms of the number of cases of COVID-19, and these numbers represent the number of cases in Westchester County. We called out here in terms of in Yonkers, there's 3,477, but in Mount Vernon, where Grace is located, a little over 1,500 cases. And New Rochelle, which was the initial source of the cases, there's about 1,500 cases. So these are the areas that have been most impacted by coronavirus, as you probably know. When we look at, in terms of age-adjusted death rates due to race ethnicity, when you look at the story in terms of New York City, the individuals of color, primarily those who are Hispanic or Latino, are disproportionately impacted, even though they only make less than a third of the population. But when you look at New York State, it tends to be white individuals that are more impacted. So the city data is interesting because this highlights really that this is a disease that really disproportionately affects communities of color. And this data we've been seeing nationally. When we look at also, this is not just only in death rate data, but when you look at those that are non-hospitalized, you see that African Americans and Latinos are also impacted. When you look at those that are hospitalized, you see the same patterns here. And then those who have known to die in New York City, you see the same pattern. So this is pervasive across both the state and the city in terms of seeing that we are disproportionately impacted. When we look at, there have been multiple articles and news pieces in the lay literature that have highlighted that the data has been missing. This has only been released in the last 10 days in terms of the race ethnicity data. And many people have called because you can't fix something if you don't have the data. And there was initially calls in terms of looking at, in Louisiana, you were seeing significant shares of African Americans, in Illinois, and specifically in Chicago. The 69% of individuals who are African American died, even though they only made up 30% of the population in Chicago. And the same pattern played out in North Carolina as well as in Michigan. We see this in New York State, which I showed you, and then just in terms of what this means, and that really some of this is really underlying in terms of the impact of bias. So we know that there are multiple factors that contribute to these health disparities, and they're complex. So it's the healthcare system, how we deliver care, an individual's personal characteristics, and then the social determinants of health, which are really the places that we work, we go to school, we worship, we are born into. These all play into a role in terms of how our health outcomes later become. And we also know that certain adverse family and childhood experiences can also play a role. And specifically, I'll call out in terms of the impact of racism and discrimination as it relates in terms of healthcare. We know that bias can definitely play a role in terms of who gets tested, who gets assessed, evaluations, and the like. The impact of COVID-19, we know also on social determinants of health are reduced access to care. We know that growing individuals are being laid off, and that is leading to more people that are becoming poor and that are being unemployed and not able to pay their bills. There's also increased housing instability, so more people who don't have safe or quality housing, and more folks that are going hungry every day. That people are feeling less connected, and that's why this forum, how Grace is allowed, this kind of using technology allows us to stay connected even in the midst of a pandemic. And then racism, but we also know that there's reports of increased physical, sexual abuse, as well as domestic violence, even in the midst of this pandemic. And then also petty crime. We are all experiencing physical and emotional stress. I think the constant news cycle is, stressful. And, we all have some level of acute stress that happens. And then there's this impact of a thought in terms of what's going to be the impact in terms of chronic stress. And this derives from unending feelings of despair and hopelessness. And many people are experiencing this just in the context of what's happening right now. Other traits, and all of these things connect to a lot of the health conditions that we say put you at higher risk for coronavirus. So hypertension, heart disease, diabetes, the list is the same. What happens to our mind and body and spirit when we're stressed? I think, we know that there are multiple things in terms of sadness, depression, anxiety, fatigue, but people can also get impatient and irritable and sometimes downright angry, and they can be short-tempered. We know that Galatians 5:22 says, but the fruit of the Spirit is love, joy, peace, long-suffering, gentleness, goodness, faith, meekness, temperance. Against such there's no law. So for us, it's really continue to stay connected, as Pastor mentioned yesterday during the service. And I think, for us, drawing on our faith is important. Everyone's encouraging hand hygiene, which is important, but we need to make sure all of our environments are clean, not just our hands, but also our minds and our spirits as well, and that we refresh ourselves with positive and encouraging thoughts. I want to make a little commercial. Just they're recently, based on the data in Mount Vernon, they've opened up a testing site in Mount Vernon, the Mount Vernon Neighborhood Health Center, and they need volunteers for registration and to administer testing. They said that volunteers do not need to be medical professionals, and they will be trained. The hours of operation are Monday through Friday from 9 a.m. to 5 p.m., and you can contact Reverend Ramal Small at this number, and we'll send this out, 914-564-2899. So now to your questions. So I just wanted to make sure that we were all on the same page, and some people sent some initial questions, so I think we'll start. So the first question is, how do I keep me and my family safe? And I'm going to call on Dr. Maitland to answer this one.
Good evening, everyone. I wanted to kind of stress that the biggest issue is maintaining distance in the home, also hand washing, but it's also important to kind of keep your face clean and also your nose and sinuses clean. Very simple things to do is using like a nasal spray can or a vaporized steamer. I don't know if you remember from the old days where you just put some water in a pot and a towel and breathe in the steam, or a steam shower would be very helpful. It's also important with all this hand washing to moisturize your hands so they're not dry and cracked, because that's also a area of entry. And to try to appreciate why it's so important to wash your hands and wear a face mask when you go outside is we have a terrible tendency to put our hands to our face. And by doing that, as just witnessed, you have the chance of transferring from a soft surface where the virus can live up to days on some surfaces and then bring it to your face. That's a way of transmitting the virus. And what's sneaky about this virus is you can be asymptomatic for up to 5 or 6 days before you have a problem. So you're going to keep on spreading it. So it's important when someone comes into your home, for instance, again, have them wash their hands straight in. It would be important, if you have the ability to do so, take temperatures just to kind of get an idea whether or not someone is dealing with a viral infection. And then also, again, maintaining your sleep is extremely important. If you don't, that will lower your immune system, so you won't be able to contain the virus. You should try, please, if possible. And it's actually even more cost effective for you to have fresh fruits and vegetables, which is an excellent source of vitamin C, which is another good way of keeping up your immune system so you can keep this in check, and staying away from processed foods. And just for your mental health sake, I really would recommend not watching television at night. Best to kind of pick up, the book that Reverend Pastor Richardson was reading regarding Acts, or some Maya Angelou poetry, just to kind of allow you to kind of get into some restful sleep. If you start experiencing increased symptoms, it's important to have a relationship with a practitioner. You do have several practitioners affiliated with the Grace Ministry, and if feel free to contact me directly. I'll try to address your questions, and you have other members of the staff. If we can't do, we'll be able to direct you to where you can get assessed, because it's important. An ounce of prevention is much better than what we have for a cure.
Thank you so much, Anne. Really appreciate your feedback. So the next question, and other people, Darlene Williams also sent this question in. Can you discuss about the new symptoms and loss of smell and taste? And so I'm going to ask Dr. Cottrol to answer that question.
Yeah, this is one of the few areas that neurology really seems to be playing a part. These symptoms may come from infections of the brainstem that the virus is causing. And we may see other things outside of the loss of smell and taste, including neuropathies. We may see difficulties in altered mental status, confusion, lethargy, coma, all from that stem from the same areas of the loss of smell and taste. We have just anecdotal evidence right now from the countries that have preceded us, China, Korea, and others, that some of these neurologic symptoms are happening. And we're seeing that also now in the United States. And these are things that we have to be aware of that could be possible symptoms, even in an asymptomatic carrier, even in a person who does not have any respiratory symptoms, does not have any cough or fever. Loss of smell and or taste may be the harbinger of COVID symptoms and disease.
Thank you so much, Dr. Cottrol, and thank you for all of you that are sending questions through the chat. The next question is, what conditions place me at higher risk to develop COVID-19? And I'm going to ask Dr. Sanders to answer that question.
Sure. So there are several risk factors that seem to put patients at greater risk for the illness and complications. Those include obesity, diabetes, heart disease, disability. Pregnancy is considered a risk factor, as well as homelessness and incarceration. Now, there's a caveat to this, though. Oh, and also increased age, and particularly age 65 or greater. There's a caveat to this, because there are people who feel that, well, since I don't have these risk factors, I don't need to social distance, I don't need to wash my hands that much, I can go out without wearing a mask. Well, that can be dangerous in more ways than one, because there is a smaller but significant proportion of people who do have none of these risk factors, who do get the illness, and not only do they get the illness, they develop complications and may end up on a ventilator and unfortunately succumb. So no one is really immune from this illness. It's also important to know that we still want people to social distance and wear masks when you're outside, even if you feel fine, and wash your hands frequently and do the other protective measures that have been recommended, because you may feel fine, but you may have the virus and could be spreading it. You could spread it to a family member or another loved one or another unsuspecting person. And that person, with or without risk factors, could be at increased risk for hospitalization, developing complications, and succumbing to the illness. So at this point, we should just assume that we are at all at a risk of developing COVID and the complications, and therefore take the necessary steps to not only just protect ourselves, but protect our loved ones, our friends, and our fellow citizens.
Thank you so much, Dr. Sanders. So I want to bring in our mental health providers, Dr. Burgess-Johnson and Dr. Toler, and if they can share in terms of how our members and community members could deal with some of the stress and anxiety that people are starting to feel related to people passing away and just the significant news cycle that's been happening. So, Dr. Burgess, I'm going to start with you.
One of the blessings that we have being part of a community of believers is that we believe. We have a belief in God. That's first and foremost. And one thing that we know, although this has come very suddenly, is that, you know, when we are born, we are expected to leave this earth when God says it's our time. So one thing that we should do is ask God for peace with that. If we have loved ones and friends that have passed abruptly, and if we're not getting that peace, we have this big community that we can pray with each other. Above and beyond mental health, we have prayer warriors that we can reach out to each other and pray with each other. So you're not alone. Don't think that you are alone. One of the biggest things that you can do wrong is to stay alone and suffer with these feelings. And also one thing that we can do if we are in the home and we're working with our children is make sure we take time to ourselves. Starting your day out early in the morning with God and having some peace of mind and working through your emotions, you know, thinking about what exactly am I feeling, doing some self-checks with yourself. And if you are in a state where you're you feel like you're in an unhealthy place, you need to reach out to someone for help. And there's a lot of free help. I am a person that I am willing to be supportive to those people. I have time. I get up early in the morning and I make myself available. I do block out windows for, you know, the work that I have to do, but I am available for support. And also New York State is offering free services as well for support.
Thank you so much, Dr. Burgess-Johnson. We'll come back to Dr. King-Toler in a second. I just want to pivot to Dr. Osborne, Olive Osborne, just to bring her into the conversation, and then we're going to go through some of the questions, some additional questions that were sent to us. Dr. Osborne?
Good evening, everyone. I saw that there was a question about the residual effects of the virus. And so the one thing that, you know, we've definitely seen that every single day something changes. And the good part of it is they're you know, doing a lot of research, trying to get the vaccine, you know, finding out about convalescent plasma. There's so many things that they're trying. And I think that's yet another thing, is that we don't know all of the residual effects of the virus. But the most important thing is that if anybody has fortunately come through the illness, that they follow up very closely with their primary care physician, because there are issues with maybe shortness of breath afterwards. And if there's any question or concern, your primary care physician should have all the notes from your hospital stay, and also have close contact just to follow up with chest x-rays and so forth. Maybe even, I think Dr. Price might be on too, and he was going to talk to us a little bit about what happens in the hospital, so that might be helpful. Every day we're learning something new about this virus and the sequela, so we should just more or less stay in close contact with our primary care doctors.
Thank you, Doctor. Go ahead, Dr. Price. There were some questions in terms of, can someone who's had the virus and gotten well get the virus again? And then I think related to that is, why are people passing so quickly, even healthy people?
Well, the question of if you have the virus, can you get it again? It seems that the preliminary information, and most of about this disease is preliminary. The preliminary information is there are some people who have gotten it twice. There are some physicians in China who had the disease, got better, went back to work, and got the disease again. So the question of antibody production. Everyone who gets the disease does not produce antibodies. And even if you do have antibodies, the question is, do the antibodies afford protection? It's not clear. So I think it's important to keep in mind that you might be able to get it again. And just because you've had it once and gotten better, it's no reason to get cavalier and stop doing the things to keep yourself safe. So that's one. And what was your second question?
One asked, why are people passing so quickly?
There is a spectrum. There are people who get the disease and don't know it. And there are those who go very, very quickly with an illness. And of course, I see patients I'm here now. I see patients in the hospital who are very sick and on respirators. And because as a cardiologist, when people come in short of breath, there's always the question, why are they short of breath? Is it the lung? Is it the heart? So I end up seeing a lot of patients who are sick on respirators and have the COVID disease. Why does it happen? There's no clear answer about that. But certainly the less well you are when you get the problem, the more likely you are to get seriously ill. And those things are primarily congestive heart failure. The heart is put into your body to pump blood. And whatever's wrong with you is less of a problem if it's pumping well. And whatever's wrong with you is going to be a bigger problem if you have heart failure or does not pump well. Patients who come to the hospital who have preceding heart failure get sick very quickly. Those who already have an underlying lung problem get sick very quickly. So those are the two categories of people who get sick, get ill, and are likely to have a very difficult time and perhaps even die.
If I might, this is Anne. One of the issues with patients who get the viral infection, it's not actually the virus that's causing as much damage as the immune response to the virus. And it's called cytokine storm, which you might have seen talked about on a few occasions. And a lot of the treatments that are now being used is to prevent the development of cytokine storm with medications that actually suppress the immune system. So again, early recognition with testing can be life-saving. Secondly, Dr. Price is right in that even if you develop antibodies, unless you develop the antibodies that block the entry of the virus into the airway, you are at risk for getting it again. So it'll be interesting to see what happens if they're able to develop a vaccine, that this vaccine is actually going to be effective, which again reiterates the importance of practicing safe protection, not only for yourself, but for your loved ones. And the one thing about asthma and COPD, unfortunately, as was witnessed when we did a respiratory surveillance for the Women of Grace luncheon a few years ago, out of the 80 people that we surveyed, 1/3 had lower respiratory lung involvement and didn't know it. And so, although people think that they're healthy, you can run around with silent conditions like asthma and COPD, and then you don't know you have a problem until you really have a problem. And so again, it's important to try to have a relationship with a practitioner who can evaluate you. And then also, when it comes to having that relationship with a provider, that you're not going to be dismissed. So it's really important to have that medical home with your primary care physician who will take you at face value and then intervene so that you can get the testing. And one thing I'm grateful for is that finally we have places where you can get tested and you don't need to be referred by a practitioner to say it's okay to get tested.
Thank you so much, Dr. Maitland. So I'm going to go through, we've addressed some of the questions already. Aretha asked, does anyone know if there's residual effects of the virus once you've recovered from it? So I'm going to pivot to Dr. Sanders, if you want to take that question.
Okay, this is also keeping in mind that this is a relatively new disease in the United States, so there's still a lot that we don't know about it. There have been questions in terms of if there's residual injury to the lung as well as the central nervous system. But time will tell. It's still a new illness in this country, and it's one that's rapidly changing. So, time will tell. And, some of people who've even been hospitalized have been recently getting out of the hospital. So we haven't had a chance to observe them over a time period to see if they've had residual damage to some of their organs.
Thank you so much. So then we have Angela McCrae asked,
hi, I meant, is the virus ever airborne?
ever airborne. Okay. I'm going to pivot to Dr. Maitland if you want to take that one.
So the virus is known to, if someone sneezes or coughs, and if you ever see a video of the droplets that get projected, it can travel a few feet when somebody is actually infected and coughing or sneezing. And then it can stay in the air for at least 30 minutes, which is a bit of an issue if you live in an apartment building. Again, this is why it's important, like when you get first home, and you're taking an elevator, that is a small space. And if they cough or sneeze onto the materials and then you touch it, and then you touch your face, or you don't take that mask off correctly, you can then transmit it to yourself. So it can either get into you via airborne and you breathe it in, or you actually touch a surface area, including your eyes, your nose, or your mouth, which will then allow the virus to gain entry. It cannot go through broken skin. I mean, it cannot go through intact skin. So that's why I was saying it's really important to moisturize your hands. And then again, it's really easy. Just like when you get home, you should wash your hands, you should wash your face. You should also use some nasal saline to wash out your nose, because the virus does not like steam and it doesn't like salt water.
Thank you so much, Dr. Maitland. And I want to know, you might have seen me touch my nose earlier and stuff. Literally, I have seasonal allergies right now, and my nose was itching. So I was like, so just to let please just keep it real.
But then you can even wash your hands, so it's okay.
Yeah, I got hand sanitizer, a key. So
I was just thinking because of my allergies.
So Darlene Williams-Smith said, not much has been said about the loss of smell and taste as symptoms. How serious are these symptoms? I think Dr. Cottrol addressed the loss of smell and taste. I just want to make sure in terms of Darlene if that was sufficient. If it wasn't, please chat in. Aretha said, if you had the virus, now that we know that many patients who were admitted had blood clots, would you advise if you recovered to take a baby aspirin? And I'm going to pivot that question to Dr. Price.
With the COVID virus, there is an activation of inflammatory processes, including some things which promote clotting, something called D-dimer, which can go very high, even into the thousands, and increase your risk of thrombosis. Those patients in the hospital get put on full-dose anticoagulation. And that anticoagulation will continue depending upon whether or not they have any documented clotting. For instance, if they have a DVT or pulmonary embolus, they would continue on that anticoagulation for 6 to 9 months. What to do with patients who just have the elevated D-dimer with no evidence of actual clot is not clear. Most patients are continuing on the anticoagulation for a period of weeks. And this is very new. How long will they stay? It's not clear. Is there any advantage to aspirin? Aspirin is an agent that reduces the aggregation of platelets. And these platelets are the little things that affect blood flow through small vessels. As far as the corona anticoagulation, it would not be helpful.
Thank you, Dr. Price. There were questions about how to remove gloves so not to contaminate. Didn't bring props to demonstrate in terms of that, but what we can do is send that out to the church family to show how to actually do that well, because it's an important thing. So thank you, Joan, for the question, and we will definitely get that out so we can demonstrate it to everybody. Dr. Cottrol, do you want to just talk about some, Michelle said, I lost my sense of taste and smell 2 weeks ago. When will it come back?
You know, I think it's variable. And as I was trying to say before, it may be the beginning signs of actually getting sick with the illness itself. And that has its own time course of being able to recover symptoms and be able to get back. So it's hard to say what what is the recovery period for the loss of taste and smell, whether it actually goes into the actual full-blown full-blown disease, or whether it just harbors as symptoms and then resolves on its own.
Thank you, Dr. Cottrol. So then the other question we have, I think Angela McCrae said, if we start opening up the state and going back out to work, what is different than before we started the shelter in place if we do not test anyone? And I think you raised a great point. I think we've heard testing is important. I think one of the issues is that we still have limited, it's gotten better, but we still have limited capacity. So even within New York State, they've increased new testing areas to get tested. But you may sometimes notice if you called, there is a delay, and sometimes they have to call you back to schedule the testing. We heard this week, actually earlier today, that the state is also going to be launching the antibody testing that will be able to tell us if we have an immune response or if we've been exposed or have been previously either infected with the virus. That will tell us if we have any immunity to the virus. So I think those two things, one, being able to expand testing and then potentially also get antibody testing is going to be important. Right now, they are prioritizing trying to do the antibody testing for frontline healthcare workers just because they have, potential high risk just given the burden of virus that they're exposed to.
Dr. Suzette,
Yes,
Dr.
ma'am.
Oyeku, I just want to add to that about testing. Whenever you have some crisis like this, there are going to be people out there who try to take advantage of it. Right now, there are no over-the-counter COVID tests that you can purchase. You can't purchase them in the dollar store. You can't purchase them in the pharmacy. Sometimes people may try to sell these online, or they may be selling them on the street, the way a number of things are sold. At this time, there are no COVID tests that you can purchase for commercial purposes. So if someone tries to offer that to you, you shouldn't do it because it's really going to be a waste of your money. These are tests that may not work, or they probably will not work. And so you really should only be getting tested through a reputable agency, through a medical office or a testing site.
Thank you so much. So Dr. King-Toler is back with us. So I wanted her to, we unmuted her line. So earlier she was going to share some insights. So Dr. King-Toler.
Good evening, everyone. I just wanted to build on Dr. Burgess had talked about the need for having routines in place. Certainly meditation and prayer are important. But one of the things that we're also hearing quite a bit is that people's sleep has been disrupted. And it is very important if you're finding that you're having a hard time to sleep. We talk about something called sleep hygiene. When you're preparing for bed, one of the things that we know that's really important is that the news is often disturbing. So we want to cut those televisions off at least no less than 2 hours before it's time to go to bed. We also want to make sure that the room that we're sleeping in is cool. When your body gets too warm, it makes it difficult for you to rest easily. And then also creating, at this time when we talk about routines and rituals, even thinking about taking a warm bath, drinking a cup of decaffeinated tea before you go to bed, and just maybe even reading. Those are things that people often find comforting to help them with getting to sleep. And that also helps with our immune system as well when we are getting sufficient sleep at this time. One of the other things that people are also talking about is creating new things to do. We are in our homes quite a bit, and the use of things like iUniversity to learn a new hobby. or to kind of distract yourself from the news that's going on. And we also want to add the importance of where you can doing some sort of physical movement, exercise, activity in home. Or if you are able to get out and put your mask on and take a walk around your block, or in your neighborhood, that would also be of assistance, again, helping you with fresh air to be able to improve that sleep.
Thank you so much, Dr. King-Toler. So I just want to let folks know we're going to go to 8:30 tonight. There are a lot of questions in the chat, and there's 132 people here, which is thank you. What we're going to do is take a couple more questions, and then whatever questions we do not get to, we likely will set up a part 2, because it's clear that there are a lot of questions that we need to answer. So hopefully folks are down for a part 2. So there's a question, and says, I was diagnosed with multiple sclerosis. Is this considered very high risk? And should we constantly be drinking hot fluids? So I could take the A part of the question, and then one of my colleagues, if they want to chime in on the B clause. So in terms of having MS and likely being on certain therapies would put you at higher risk for this virus. Definitely, it is something you want to discuss with your doctor, but we know that depending on some of the therapies that you're used to treat MS, those can suppress your immune system further. And so definitely the same precautions you're going to take in general, but I think for someone with MS, it's even at higher risk. I'll probably pivot to Dr. Cottrol, just as she's a neurologist, and the blessings of having all these beautiful doctors on the call. So Dr. Cottrol, do you want to just extend there?
Yeah, I think that exactly what you said is correct, and it probably is the case for anybody who is on immunosuppressive therapy, like cancer patients. MS would be very similar to that, so that the people who are who have a diagnosis of MS are at higher risk of potentially contracting the illness.
Thank you. And then the question in terms of drinking warm fluids, I think it's a balance. I think everything in moderation. I don't think there's anything to say like if you drink warm fluids that's going to put you at higher risk or it's going to be protective. I think it's everything in moderation. So Danielle Pulliam said, what about the antibody testing? And what if you had symptoms but never got tested in self-quarantine? Are you now immune? Please explain herd immunity, and is that connected to when it will be safe to stop self-distancing? So we have an immunologist on the call, Dr. Maitland.
Understand that COVID comes from the same family of the common cold, right? And we've yet to develop a vaccine for the common cold. And this virus has the opportunity to mutate, and actually the variants that came out of China differ from the variants that are coming out of Europe. So there are a lot of challenges to developing a vaccine, and there are a lot of challenges to the human body to develop protective antibodies, because as Dr. Price had brought up before, individuals have already had the virus, and then weeks later, they got reinfected. So this is not a question about the newer part of the immune system called the adaptive immune system that makes antibodies. This is a question about what's going on at the level of the tissue. And is the tissue healthy? So, this is where the rest comes in, the nutrition comes in, the hydration comes in. If you're smoking, please stop. Also, there are some supplements that are known to be helpful to help stop the virus from gaining a foothold. And then if it gets a foothold, it does not transmit a signal to the rest of the body to develop this clotting issue that Dr. Price had brought up. And also it doesn't go into this overdrive of cytokine storm. at this point in time, herd immunity has not been demonstrated. There has been some treatments that you might have heard on the news where people with very, very high titers, high levels of antibody against the COVID-19 was shown to help people, but it had to be very, very high titers because then the person actually had an opportunity to make antibodies against the virus that prevents it from jumping into a healthy cell. So at this point in time, I'm just going to reiterate what all the other doctors and practitioners have brought up during this webinar, is that it's going to be a new world order where we learn how to be safe with ourselves and be a true neighbor to all that are around us by not only protecting yourself, but being conscientious of our elders who are at a severe risk of getting a bad course following COVID exposure. Again, I would have to reiterate, the antibody tests or the antibody levels at this point in time have not been protected. They're running studies, but it's been kind of hit or miss, and so have been some other studies, and we really need to do a lot more research regarding, do we use heparin and other agents that help stop inflammation and clotting? Do we use immunosuppressive agents that work on different parts of the immune system to prevent the cytokine storm? There's a lot more research that's being actively pursued, and I think it's important that right now, all we can do is really the basics, as you would do for your children. Sleep well, eat well, fellowship, exercise, and a good way to help your sleep. And I'll leave this to Dr. Erica King-Toler, that exercise is really important for allowing you to sleep well as well. And then, have video chats so that you don't feel so isolated. Our immune system will work as well as we are not stressed. So, and I would just emphasize the fact that we need to kind of just keep our focus on not getting it, and then if you get it, not sharing it.
Thank you so much. I want to just also give a shout out to Dr. Aisha Primer on the line, as well as Dr. Alexandra Lewis is on the line as well. So thank you guys for joining, and I probably will, if there are questions, definitely to have you guys engaged. There was a question in terms of going to the doctor. Okay, Beverly Jabert said, I recently got a call from my ENT, ear, nose, and throat for an appointment. Do you advise to schedule an appointment to see your primary care doctor, i.e. dentist, ENT, etc.? So Dr. Sanders, I'm going to pivot to you for this question.
Okay, so what is becoming the trend now and during this pandemic is telehealth. And the reason why that has been occurring is for a number of reasons, but largely because of social distancing. When people think about going to a doctor's or a dentist's office, they think about going to a waiting room where there are a lot of people who are sitting in chairs next to them. And there's also the very real issue about the accessibility of personal protective equipment, which has become very scarce because it has been largely being funneled to the front lines of medicine, particularly in the emergency rooms, in the hospitals, and in the ICUs. So for that reason, and for a host of reasons, many offices are closed during this pandemic. The alternative has been telehealth, where doctors and dentists are trying their best to manage patients over the telephone or through virtual media. If for some reason it seems that cannot be done, they will refer them to a site and each doctor has a different site, whether it's an urgent care center or an emergency room, where they can be evaluated. And again, the concern about sending people to the emergency room is that emergency rooms have become overwhelmed with patients, and we're trying not to have patients go there and possibly being exposed, because the reality is in many emergency rooms, and I'll say specifically in New York State and in this
So
New
we're
York
talking.
metropolitan area, there are a large number of patients with
Okay, no, I
COVID.
can.
So
But I can.
the hope is to try to prevent people getting exposed to the virus unless it's absolutely necessary.
Thank you so much. So I'm just going to pivot back to Dr. Burgess-Johnson just to see if she had any additional comments that she wanted to make in terms of maintaining our both emotional and then also thinking about parents having children at home in terms of any of the behavioral health needs at this time.
In terms of maintaining your keeping your stress level down, you know, getting together with your homegirls, your homeboys. I have put together with some of my friends a paint and sip and paint. So, you know, one person will play music and we're painting something on through Zoom. So we're talking, we're conversing, we're laughing, and it's through Zoom. Now, Zoom is free for the first 40 minutes if you have a group of more than two people, I think. It's free for the first 40 minutes. If you do not want to subscribe to it, you can jump off and then jump right back on and continue to engage with your family, with your friends. It's one way that, you know, we haven't been able to see each other. We haven't been able to touch each other, and that's okay. Thank God we have the internet so that we do have this platform where we can engage. Zoom is another method that can be used on Zoom is play dates. So if your children are missing their friend, that you can reach out to their parents and you can schedule a play date. They can have their favorite toys and they can engage with each other for 30 minutes to an hour or however long you see fit. Instead of talking on the phone to their grandparents, they can do Zoom meetings with their grandparents. Another thing that is helpful is having family time with your children, board games, getting back to the basics, old school, sitting on the floor, playing family board games, playing card games, setting aside time for each of your children individually where you can just have conversations and talk through certain things. One thing that has been a blessing with COVID-19 is getting us to slow down. Usually we run out of the house early in the morning and we don't get home till 6:30 at night, and then we're rushing through homework. Now you have time to really spend time with your children, see how they're learning, see what supports you can put in place to better expand on their learning. Try different things with them, and you don't have to rush through their learning experience. If you have a child who you may think has ADHD and cannot sit and focus for an extended period of time, let your child work for 30 minutes and then give them a break. It's okay. You have the whole day to get it done. I know here in Mount Vernon, the children, their schoolwork is not due until 11:59 at night. So you can break it up throughout the day. But what I will say is, I would stick to a sleeping schedule as much as possible. If your child was going to bed at 8:30 before, try not to let them go past 9 o'clock, 9:30, so that you can still have your sanity as a parent. Like, we still need our time at night to let go of what we've experienced throughout the day and take time to ourselves. So I will say, you know, meet with your family and friends via Zoom, have conversations with people that you haven't had conversations with in a long time, and set aside time to actually spend time with your family. Husbands and wives, spend time with each other, have dates. If you have to get up at 5 o'clock in the morning to have a coffee date before you start your day, do that. This is the time to get back to the basics and actually have relationships and build upon those relationships.
Thank you so much, Dr. Burgess-Johnson. So there were several questions about masks. Should you wear them? Can you wash them? Dr. Maitland has responded in the chat box.
Right now, there are two procedures that are being looked at, recollecting masks that have been used and then sterilizing them. It's been developed by a company called Batil, where they actually use hydrogen peroxide or UV light or a combination thereof. They're collecting them, they will sterilize them, repackage them, and then redistribute in order to address the shortage of face PPE. I would there's a difference between the PPE that needs to be used by people who are employed in either first responders or the medical health profession, where you're in intimate contact with patients, where you're at risk for getting exposure. The purpose of the covers is to prevent you from touching a surface area and then touching your eyes or your nose and your mouth, and then you get infected. No different than a child who, you wash the surface areas so that so you wash the surface areas so that when they touch that surface area and then they bring it to their face, that they don't get sick. We touch our face at least once or twice a minute. And actually, you might be seeing me turn because I have a tendency to do that or think like this. And then I end up being at risk. And so it's important to know that the purpose of it is to prevent you from touching your face. As far as protection against your eyes, I think that's only a concern is if you're in a closed space. Wearing eyeglasses, as the erudite looking Dr. Oyeku is doing, would be helpful. I don't think you need face shields. Someone actually asked a question about the need for wearing a face mask in a car. If you're in the car by yourself, there's no need. The biggest issue is if you're commuting with other people and you don't know what their status is, then I would wear it. Or if you get your car serviced and you're a little bit concerned about who was in the car and they didn't do a proper cleaning after that, then I'd be concerned. Other than that, your car is a safe space. It really is a question of where does this virus have an opportunity to live? And then someone actually wanted me to pivot and answer questions about supplements. So the supplements that we have been recommending is oil of oregano and vitamin C. And you don't necessarily need to buy ester C. Vitamin C is in lots of fruits and vegetables, whether you're talking peppers or fruits like blueberries or oranges or citrus. That's a good way of getting your vitamin C without having to buy a processed vitamin, which is off the shelves, at least here in New Rochelle. Oil of oregano is a good way of suppressing the overactive immune response, and also acts as a way of suppressing infectious agents from getting a foothold as well. And the other supplement that we've been recommending is N-acetylcysteine, or NAC. And there's a fourth one, zinc. And I have to tell you, I'm not a big fan of zinc, the nasal spray, because that actually, and Dr. Cottrol might want to comment on this, that actually, there's been, using zinc straight in the nose is known to kill your smell. So if you're going to use zinc, use it as a supplement orally, and then do it on a daily basis. Any other suggestions, feel free to send me a message. I'll answer it via the chat, written chat form.
Just want to go through a couple more. So we went through some of the math questions. Jay LeVar asked, can we discuss the impact of the virus on kidney failure and dialysis patients? So I'm going to ask Dr. Price to touch on that if he's still on the line, or Dr. Lewis, if she's on the line, we can unmute. Go ahead, Dr. Lewis.
I'm actually on call and I'm at work right now, so please excuse
the dedication.
If you hear a page and I have to go. So we actually find that patients who have renal failure actually do quite poorly if they've been exposed to corona and have the severe form of coronavirus. In particular, when we think about what our lungs do, that's primarily where most patients are having the most severe symptoms. Our lungs are a way for us to pick up oxygen, and that oxygen gets absorbed into our bloodstream, and that's how we deliver oxygenated blood to the rest of our organs. So in patients with very severe forms of coronavirus, you can imagine that patients do not have that ability to have high concentrations of blood in the bloodstream. And so as a consequence, you're jeopardizing oxygen flow to important organs, one of which are the kidneys. So I think that if you are someone that develops a very severe form of coronavirus, you may potentially be at risk for worsening renal failure, which might require you to have to go on dialysis if you're not already on dialysis. So that's just something to consider. So that's about as much as I can tell you from that standpoint. But yeah.
Thank you so much, Dr. Lewis. Do you, you're, on the front lines, and I see Dr. Price. So Dr. Price, go ahead.
Well, before we talked about why some patients get very sick with the virus. One of the things that can that we know is a problem. The patient comes in. If the patient comes in and has renal failure, we will anticipate that they'll have a stormy course. So heart failure and abnormal renal function when a patient comes into the hospital is a marker for someone who's going to be very sick.
Thank you so much. Dr. Lewis, if you want to speak to earlier, someone had asked in terms of individuals having this rocky course and potentially decompensating quickly. You're an anesthesiologist. In terms of what are you seeing on the front lines in terms of the respiratory compromise that folks are having and who, might be more apt to have that?
Yeah. So I think that, patients, our biggest concern is them kind of falling off very quickly in terms of their oxygenation. And so what we find is that patients, we have a tendency to intubate patients actually earlier than we typically would. We find that patients who are on up to 6 liters of oxygen, which is actually a fairly high requirement of oxygen, we have a tendency to, that's an indicator that they will most likely require intubation and mechanical ventilation. Unfortunately, when you look at the numbers of the patients that are mechanically ventilated, the mortality is quite high. In the literature, it's up to 80%. And what we found is once patients are intubated, the things that we are trying to do in order to improve their oxygenation is a couple things. You may have heard in the news of hydrochloroquinone, which is what Donald Trump has frequently mentioned in the media. So that is a part of the protocol. And there are other antibiotics which also help with reduce inflammation in the lungs that have also been used as well. Other things that we can do once a patient is on a ventilator is what we talk about is proning, which is the actually rotation of the patient. So normally when you sleep, a lot of people will sleep on their back. But what we found is that over time, your lungs, particularly in the dependent portion of your body, have a tendency to collapse. So the thought behind proning is you rotate the patient so that they're lying on their stomach. And the hope is that the areas of the lung that have been dependent and collapsed will be able to recruit those parts of the lung so that they oxygenate better. And what we found is that with process of proning, putting people on their stomach, in some cases that can improve oxygenation and patients can get better on the ventilator. We've also found that patients who have not been intubated and put on a ventilator, we have been able to delay them having to even go on a ventilator by putting them in the prone position. So basically having them turn themselves over and seeing if that improves their oxygen levels. And we found that we are seeing positive results with that. So that's one intervention that we can do to try and help improve oxygen levels in patients. So there are numerous things that we're doing to try and improve how the lungs are functioning. And those are a few things that are currently being done. Yeah, I don't know, does anybody else have any thoughts on management? I mean, mostly what I do is put people on a ventilator and try to do what we call protective lung ventilation. We're trying to protect the lungs from overinflation, and we're really try to treat the lungs with kid gloves so that over time the lung can heal itself. And so that's why we do some of these interventions, to try to prevent inflammation, to try and ventilate the lung in a way that is protective and we're not causing any strain on the lung tissue, so that over time the lung will be able to heal itself.
Go ahead, Dr. Maitland.
There's some evidence coming out of Mount Sinai and Columbia with the use of anticoagulant agents, because they're showing an increased risk for clotting and even very small clots that are in the small parts, vasculature of the lung, called microocclusions. And so they're hoping to use agents to kind of reduce the injury that comes from a aggressive clotting response following COVID exposure. And intervening with things like low molecular weight heparin is actually being pursued as studies. And then I actually had a patient who had COVID and had a clot, and she actually had to get TPA, which was very helpful for breaking up her DVT and PE, a pulmonary embolus that was in her lungs as well. Part of the immune response, so the purpose of our immune system is to defend against some type of agent or that's causing injury, which means increased blood flow. And that typically means that the tissue is going to call for heparin release, as well as cytokines that are going to call in the cavalry. And sometimes it's such an over-aggressive call, the immune system basically it's like calling the fire department to come to your house, and somebody burnt something on the stove, but they took out the hoses and basically hosed your kitchen in your house, and the damage from the hoses hitting your house caused more trouble than the actual smoke that came from the burnt food on the stove. So this is what is called cytokine storm, where the viral infection, it's brewing for days in your upper airway. And then finally a signal gets sent to your lungs and possibly to the rest of your body saying, we're seeing something here really bad, and we need you to kind of go to DEFCON 4 very quickly. And we don't know who that happens into. So this is why it's so concerning that if you have these symptoms and you don't have a diagnosis of asthma, or you don't have a diagnosis of COPD, or your hypertension is under control with exercise and diet, we don't know who goes to 75 miles per hour with the immune system. So a lot of the treatments that are being used right now, you have primary prophylaxis where we are giving either immune serum, we're giving Plaquenil, but just like with Tamiflu, which is used for influenza, you have to give that Plaquenil early in order to prevent that call into the immune system that then goes and causes the damage in the lungs. If you start the Plaquenil after you're talking about potentially going onto a respirator, it's too late. Then there's the use of heparin, which not only acts as a way to break up a clot or prevent it, but it actually has anti-inflammatory effects. As it turns out, heparin in the 70s and 80s was used to treat asthma exacerbations. So it has the ability to work two different ways. And I think the thing about medicine, we all have, the body is so wonderfully complex, and they all have multiple jobs to do, which requires communication. And what we need to do to beat this virus is what we're doing right now. We're talking amongst each other, sharing these stories and coordinating that information so we have a much broader view. Again, just to reiterate, it is important to protect yourself, protect your loved ones, protect your neighbors by practicing self-distancing, using, washing your hands, washing your face, wearing a mask so you don't catch it and you don't communicate what you might not know you are carrying to someone else who might be more susceptible to having a bad outcome following exposure to the virus. And right now, most of the research that's going on is focusing at developing a vaccine, and we're easily 12 to 18 months away from that. Collecting serum in high enough quantities, and there's studies that are going on. So if you've been exposed and have recovered, it might be worthwhile reaching out to and participating in these studies, because your serum might save somebody else. There are anti-inflammatory agents, such as what's being used for not only multiple sclerosis, but also for certain forms of arthritis, called anti-IL-6, which is a chemical that calls in parts of the immune system, that also is shown to have some efficacy. So this virus has different ways of causing problems. This is a multidisciplinary effort that needs to cross, psychiatry, pulmonary, cardiac, dermatology, ENT, family medicine. It's all hands on deck. And there's ways of you helping as a medical professional, but there's also ways you can help, like volunteering and getting people registered so they get tested will be a huge benefit for getting this scourge that is just devastating so many of us in these communities, which I guess leads into the wonderful site.
Yes, this is we're close to wrapping up, if that's okay. Thank you so much, because people were texting in terms of cytokine storm. Thank you so much, everyone, for joining. What I have on the screen is just the testing sites in Westchester, in terms of, as I mentioned, the walk-up facility in Mount Vernon and the one in Yonkers, but there's also drive-through facilities in Valhalla and New Rochelle. You can call this number here, 888-364-3065. There are many questions that are in the chat, and we, like I said, we're going to save the chat and try to respond, but I think based on all the questions, we definitely are going to need to do a part 2. Darlene Williams-Smith actually had some gloves and was going to show us how to do that, but I want to be mindful of the time. We are going to ask for your feedback, so right before we close, if you can just give us a thumbs up or thumbs down in terms of how this session was for you. We had close to 130 something people tonight, which is a lot on a Monday night. But I just want to say a word. I think Dr. Maitland mentioned it already, but there's a lot of research that's happening because this is new, and we don't know. We know what we know, but we also know that we don't know a lot of things. So stay tuned in terms of some of the treatment options. The resources, if you want more information, definitely the New York City, New York State Departments of Health, Westchester Department of Health are good resources. Also, the Centers for Disease Control and Prevention are options, or the World Health Organization, or your local hospital website actually has, many of them have dedicated pages to COVID-19, and also your regular primary care provider. I want to, I think it was, it said COVID Part 2. Many people also had mentioned that there may be desire for strategies for small business owners maintaining your financial health and education tips, given that this is going to be, we're going to be on pause for a little bit. I want to just thank the panel. They have been amazing with all the questions, and just the beauty to see all of these beautiful brown faces that are healthcare providers. If you have children, it's a beautiful thing for them to kind of see the diversity of medicine and psychology and just what can happen. So I'm just gonna see if anybody has just final things they want to say before we close out. So Dr. Price, I'll start with Dr. Price.
The thing I like to say is that, we hear that the curve is flattening, and that doesn't mean that we should let up and drop our guard and assume that this battle has been won. I think this is like a 15-round heavyweight fight, and I think this is about maybe round 11. So we're more than halfway, but still a lot of work to do. We still have to be vigilant. We still have to be careful. We still have to look after one another, families and strangers alike, if we're going to beat this problem.
Thank you, Dr. Price. And Dr. Lewis, because I know I saw a couple of people come in to get you in.
Okay. Oh, some advice you said?
Yeah, just any closing 2 words that you would want as a healthcare provider that you want people to know.
I think, stay safe, continue to wear your mask, keep your social distance from each other. I know it's hard and it's frustrating and it can be very trying, but you're doing a huge service to the healthcare providers out there. We come to work to help you, and if we're overwhelmed and we have an excess of patients coming to the emergency department, we're going to have a really hard time getting to everyone. And so just like Dr. Price said, even though the curve is flattening, we need to keep doing what we're doing and see if we can bring those numbers down even further.
Thank you so much. Be safe tonight. Dr. Sanders?
I just want to stress how important information is. And if there's any time in our lifetime with the various medical crises, information is going to increase your chances of surviving the pandemic, which means nothing's guaranteed, but the more information you have, it decreases your chances for emergency room visits, hospitalization, ventilation, and succumbing to this illness. So I know that the information is a little disturbing, but for many people, it can save your life. And I just want to add one other thing to that. Every day, Governor Andrew Cuomo gives an update for New York State around 11:30. It's available on most cable and television news outlets. He has assembled an excellent team of experts, not just in medicine, but also with expertise in public health and with infectious diseases. He puts this information together. It's very concise, easy to understand, leaves a lot of the emotion out, which has got to be very difficult. So I would say if you are sheltered in, really try to listen in to his updates it's usually around 11:30. Sometimes he starts a little late, I guess, because he's gathering more information. But I would really recommend that would be an excellent source of information from the governor in terms of how it pertains nationally, but also for us as New Yorkers.
Thank you so much, Dr. Sanders. I would love to go round robin with everybody, but I think we'll still be here. But Dr. Burgess has said for coping strategies to minimize stress, considered mindfulness body scanning. Simply go to YouTube and type in mindfulness body scan, lay back on the floor, and follow the body scan. Dr. Maitland said, be safe. It's the new normal, but it is an opportunity to let God work through us to walk in a path and be closer to him and our beautiful village. Peace be with you. I want to just give the last word to Pastor, if that's okay. Well, right before I get to Pastor. So Michelle is saying you can do the thumbs up you can do reactions on the bottom, and you can either do thumbs up or thumbs down to let us know how we did tonight. We really appreciate it. Dr. King-Toler said, stay connected, don't let yourself get isolated. Really, really want to thank everybody. Pastor, it's to you.
Doctor, let me tell you, this was a marvelous gathering. I want to thank all of our physicians. It's definitely thumbs up. You have added, as you've always done for the last several years, in contributing to the health of our congregation. And you also make our ministry relevant because there's a holistic issue around what is happening to our people. There is the issue that is centered, the health and the pandemic, but it's also the fallouts of the pandemic. And we, as a church, have to try to address all of that. We have 500 people a week, 500 families a week who are coming to the sanctuary to get food. They're hungry. We have 22 million people across the country without jobs, and many of our people don't have jobs. And then there is the spiritual, which the psychologist made reference to, the whole issue of spiritual health. And all of these dynamics ought to be appropriately addressed in the context of the faith community, in the context of a relevant ministry. And I'm thankful to all of you because you help to make Grace's ministry relevant and meaningful, and you help to save our lives. And I want to thank you. I appreciate, I'm always proud of our doctors because you represent such an achievement for African-American people. We've been a struggling people, but you represent those who have achieved and gone forward. I always talk about Dr. Lewis. When I was in the hospital and I looked up and saw her, I knew I was all right. I was going to be okay. So I know that you all are making a difference in our lives. I want to thank you tonight for being here, and we'll reassemble again. Thank you, Dr. Suzette Oyeku Jones. Thank you, Dr. Standard. God bless you.
Thank you, guys. Thank you so much. Really. Thank you. Have a peaceful night.
Thank you.
Well, we will respond to the other questions.